Hi, my name is Laura Denham, and I am a fourth-year student at Cal State San Marcos studying speech-language pathology. And today I am here to talk to you about how to protect the voices of teachers. Without protecting our voices, it can lead to vocal damage, which includes nodules, polyps, and edemas. Nodules are growths that occur on the vocal cords, which are similar to calluses on the hand. You might also get polyps, which are larger than nodules, but more similar to a blister, or an edema, which is swelling on or near the vocal cords, which can even obstruct breathing if not taken care of. However, all of which can result in a change in voice, making it sound breathy or hoarse and contribute to discomfort. For reference, this is what healthy and normal vocal cords look like. This is what vocal cords with nodules look like. This is what vocal cords with polyp looks like, and vocal cords with an edema. Without taking care of our voices, it can also lead to respiratory damage, which includes having defective control of breathing, which leads to problems with the respiratory system as a whole. Might also get gastroesophageal reflux, which occurs when acid from the stomach repeatedly goes back into the esophagus, which is the part of the body that connects the mouth to the stomach. Because it's acidic, it can completely damage your esophagus and esophageal tissue, making it bleed or narrow or lead to just changes throughout the esophagus. One might also get vocal fatigue. So when constantly speaking, it can lead to having vocal fatigue, which eventually leads to more severe consequences. Some symptoms of vocal fatigue include hoarseness, lost or cracked notes, loss of intonation and expression, constant throat clearing, and swallowing difficulties. Although not enough research has been done, some research has indicated that there is a correlation between having psychological difficulties and voice disorders. More research needs to be done, but based on current information, some of the more significant complaints were issues with major depressive episodes, generalized anxiety disorder, having phobia, post-traumatic stress disorder, and increased sick leave. There are other possible voice disorders that one might get, like having other types of lesions or issues with articulation. One scary but true statistic is that 1 in 2, so 50% of female teachers reported voice disorders compared to reports by 1 in 4 males. So there are also costs of vocal damage. Approximately 600,000 teachers in the United States miss at least one day of school each year due to having issues with their voice. When teachers miss school, substitutes have to be hired, which costs the school district an immense amount of money. And because teachers are only given a limited amount of sick leave to begin with, they shouldn't be wasted on something that the district can help prevent. Vocal damage and disorders in teachers cost the United States economy approximately $2.5 billion each year. When a teacher has vocal damage, it not only has an effect on the economy, but also has costs on a student's learning, because the ability to deliver instructions or information is impacted and forces educators to change their education plan or lesson plans for the day and reduce the number of learning activities. So when maintaining proper vocal hygiene, not only do teachers reap the benefits, but taxpayers and students do as well. So some ways to prevent vocal damage and to maintain proper vocal hygiene. The number one way is to have your district provide microphones and amplification systems, because it allows teachers to use a normal volume without having to speak louder and put strain on the vocal cords. Although it can be hard, please try to stay away from or at least limit your coffee and dehydrating drinks and increase your water intake. Drinking beverages that are dehydrating contributes to having a hoarse voice and often lots of phlegm, which encourages you to clear your throat, which is horrible for your vocal cords. Proper hydration is needed for proper phonation and necessary for having vocal stability and a smaller likelihood of injury. Being a teacher, I'm sure it's difficult to keep your classroom quiet, but try your best not to yell when it does get loud, In the case that you need to get the attention of your students, maybe try using an alternative technique like clapping, stomping, knocking, or even using different incentives. Try to limit your yelling and your whispering because they're both considered vocal extremes, which slams your vocal cords together. As always, try your best to prevent vocal damage and rest your vocal cords. Prevent abusive behaviors like constant coughing and clearing of the throat, whispering and yelling. And be sure to provide yourself with vocal rest, even if it's just for 5 minutes, like when students are taking a test or outside for recess. And please do not smoke, or at least limit your smoking, because it not only damages the vocal cords, but also damages the lungs, which is necessary for breathing and proper phonation. Just for reference, this is what a healthy lung looks like. These are what smoker's lungs looks like. And this is what smoker's lung looks like. Smoker's lungs look like just after 90 days of quitting. Thank you so much for listening to my presentation. I hope it helped, and I hope you were able to learn something. Thank you.